Hello all, I am Dr. Walter from SNS College of Physiotherapy. So today we are going to see another video regarding ethics. So here I have mentioned only the term ethics. So as a physiotherapist, we need to follow ethical knowledge in our day-to-day life. Okay, so here I have mentioned up to 10 points. So as a physiotherapist, not only the physiotherapist, even a physiotherapy student who is studying his or her first year, he or she should know about the 10 points. The 10 points will complete the total ethics in their day-to-day life. First, respect to the patient. As we are in the healthcare field, we are going to see n number of patients in our day-to-day life. Once, if we are entering into a clinic, we are going to receive n number of patients. We can take one patient for this total video content. Okay, so a patient is coming. Now we are going to greet him. How we are going to greet him? Hello, hi, like that we are going to greet him, and then we are going to respect him or her who are coming to our clinic. Respect is most important that a patient deserves. Okay, now informed consent. Now the patient has arrived to our clinic, we have greeted them, we have given respect to them, and we have made them to seated at their comfortable place. Now informed consent, it means what type of pain or disease or what type of disorder that the patient has came to our clinic, we need to note it down. Okay, so we need to note it down and we need to tell them what type of treatment plan we are going to treat them. It is more important in this field. If we are not informing them about the treatment, it is a greater mistake that they will not accept the type of treatment. Next one is the third type, confidence. This type of thing should maintain among the patient and the therapist. The patient must maintain the confidence on the therapist. How? The things which we are confirming in the second part, we need to document and keep it in a private area. None of the people, like other than the therapist, other than the patient, should know about the treatment or the disease or the disorder of the patient. This is most important to bring up the confidence in between the patient and the therapist. Next one is professional competence. As we are in a advanced AI technology, we need to develop our knowledge in the day-to-day life. It is most important that we need to concentrate things more on AI and the advancement of the physiotherapy field, so that we need to learn a little bit more compared with the early lifestyle. Doing good and don't harm. As the patient belong to any type of area or any type of class, upper class, middle class or lower class, as a physiotherapist we need to be neutral, we need to do good to them. Okay, we should not harm them in means of treatment, in means of words, in means of their disease or disorder. We should not harm them. As a physiotherapist and a medical care worker, we need to do good to all the patients which we see in our day-to-day life. Honesty and equality. We need to be very honest in our treatment pattern. Okay, so giving treatment for just 1 or 2 10 minutes and leaving them alone, and giving more important to the patient who are giving more amount to us, that is a very wrong thing. We need to treat patients in equality manner. If the patient is giving the less amount of amount, the patient giving more amount of amount, all should be equally balanced, and honesty should be maintained in our treatment. Boundaries. Most important thing, as a physiotherapy student, physiotherapist should know about the boundaries. We need to make a boundary between the patient and the therapist. So the boundary should not exceed beyond the personal life. We as a physiotherapist should stand in our area. As a physiotherapist, we need to treat them, we need to recover them. That is the most important thing, other than the unwanted things we need to avoid. Documentation is most important thing. We need to collect all the data, the name and all the past history, the present history, document and keep it in a file. Documentation in India, it is ongoing. In foreign countries, it has been converted into ICD codes. But nowadays, India also following the ICD codes. Hope physiotherapy will follow ICD codes in soon level. Hope you might have understood the ethics of the physiotherapy, and this is a very clear term you need to learn. Thank you.